Hello everyone, welcome to another NP Academy lecture. Today we will talk about role of this drug called Remdesivir in the treatment of COVID-19 patient. So we'll look into Remdesivir and how this drug help to treat the COVID-19 patient. As you all know, COVID-19 is the name of the disease. This is caused by the virus, and the name of the virus is SARS-CoV-2. SARS stands for Severe Acute Respiratory Syndrome Coronavirus 2. As we all know, there is no effective treatment of COVID-19 as of now. So there is an active search for it, and in this search, Remdesivir has been gaining some popularity. There are some early results that shows that Remdesivir has antiviral activity against SARS-CoV-2. So to look into this further, a group of doctors from here United States, they did a small clinical trial and they published this paper in the journal called New England Journal of Medicine. This work was published in this month actually. It's a very respectful journal and it's a very good finding. So let's look into it. The question number one is why Remdesivir? Why they pick it? And the answer is this. First of all, this drug has a very broad spectrum antiviral drug. So broad spectrum antiviral drug. Other interesting thing about this drug that this Remdesivir has antiviral activity against two different coronavirus. One of them is called SARS coronavirus that caused the SARS back in 2003, that also happened in China. And the other one is called MERS coronavirus that caused MERS in 2012. MERS stands for Middle East Respiratory Syndrome. And this Remdesivir has antiviral activity against both of these coronaviruses. So the fact that the SARS-CoV-2 also belongs to the coronavirus family, it makes sense to think that Remdesivir may have antiviral activity against SARS-CoV-2. So to look into this further, a group of scientists from NIH, they did a study on monkey model. They did a study on rhesus monkey model. What they did is they took the monkeys and they infected them with the coronavirus. They took the monkey and they infected them with SARS-CoV-2. Then these monkeys developed the disease COVID-19. And then they divided these monkeys into two groups. And one group received the drug Remdesivir, so we'll call it positive. And the other group did not receive the drug, they will call it negative, that acts as a control. And after 6 days of treatment, they looked at the lung and they found that these monkey who had a COVID-19, when they got the treatment with the Remdesivir, they did really good. They did better. They had a less lung damage, less pneumonia, and they had a less viral load in their lung. While the monkeys who did not get the treatment, they did really worse. They had a bad pneumonia, worse lung damage, and they had a high viral load. And we are talking about this virus is the SARS-CoV-2. So this study also suggests that Remdesivir probably has antiviral properties against SARS-CoV-2. So based on this, these doctors, they set up a clinical trial. They enrolled 53 patients only. So that's one of the drawback of this study is the number of patients. They had a total number of patients only 53, very few. However, these patients were really sick. First of all, they all had positive test for coronavirus. They all had the severe case of COVID-19. Severe COVID-19. Their median age were 64, so they were a little bit older. They all had many comorbidities like diabetes, asthma, hypertension, hyperlipidemia. Not only that, of all the patients who were involved, 64% of the patients were intubated and only 36% were not intubated. So as you can see, even though they had a small sample size, they had a sick patient. So with this patient, they gave them Remdesivir, and here was the treatment plan. They all received Remdesivir. They all received this drug IV daily for 10 days. So on day 1, they all received 200 milligram, and then on day 2 through 10 they received 100 milligram daily, and they monitored this patient for 18 days, so even like 8 days after the treatment. Okay, here's what they found. They found that of all the patients, the overall 68% of the patient, they showed overall improvement. They did better improvement. And the criteria for improvement was maybe they needed less oxygen. If they were intubated, maybe they got extubated. If they were on the BiPAP, maybe they went on to the nasal cannula or room air. So those kind of criteria they had. So 68% got improvement. 47% of them, they were discharged and went home. Well, that's good. 15% they didn't do good. Their condition got worse. And 13% of them, they died. So that's kind of little sad. If you break down these information into two groups, the group who were intubated and the group who were not intubated, then it's become even more interesting. So let's look at the group who were not intubated. So total number of patients in this group were 19, and they were like 36%. Out of this 19 patients in this group, 2 of them were on room air. And after the treatment, 10 days course of Remdesivir, all these 2 of them, they all got better. They all went home. They were discharged. So here you have 100% recovery rate among the patients who were on the room air. Well, that's good. 10 patients were on the nasal cannula. These 10 patients, after the treatment, they also got better. They also went home. So you have another 100% recovery rate among the people who were on the nasal cannula. Then you have a 7 patient, they need a little bit more oxygen. They were either on BiPAP or they were on the high flow nasal cannula. Out of 7, 5 of them, they got better and they went home. So this 5 of them, they become your 71% of recovery rate among the people who were on the BiPAP. Well, 1 of them, they got worse because they got intubated. So that's kind of not good. And then 1 of them, they died. So the death rate among the patients who were not intubated is your 5%. Like 1 died out of 19. However, all the patients consider the discharge, the patient who went home from this group, were your 89%. So close to 90% were discharged, went home. 1% got worse and once died. 1% died. So that was the things among the patients who were not intubated. Let's look at the patients who were intubated. So the group who were intubated. There were 34 patients in this group, so that is 64%. Out of 34, 50% of them they got extubated after the treatment with the remdesivir for 10 days. So that's really impressive. Not only that, 24%, so your 50% is like here your 17%, 24%, like your 8 of them, they did so good that they went home, they were discharged. And 6 of them, like 18% of the patient in this group, 6 of them, they died. So the death rate among intubated patients was 18%. However, 50% got extubated and 24% went home. So if you put these data into perspective, they compare this data with another study that was published from China. They compare this with the China data. There they looked at the 200 patients who had a severe case of COVID-19, who were hospitalized in the hospital, and they looked at the overall death rate, and then they looked at the death rate among intubated patient death rate. So you had a 200 patient from China, and they compared this to the patient who were in this study. There were like a remdesivir treated patient. There was only 53. What they found is that in this 200 patient who had a severe case of COVID-19, the death rate overall was 22%, while the death rate in this study when we treated them with the remdesivir were only 13% overall. However, among the patients who were intubated, the death rate among the Chinese patients was 66%, while the death rate among the patients in this study were only 18%. So this is a very significant difference among intubated patients, specifically 66% versus 18%. So putting everything together, what this study shows that even if you have a very severe case of COVID-19 who happen to have the older in the age and who were intubated, when they treated them with remdesivir for 10 days, the overall death rate was significantly low compared to when they compared it with the China, 66%, and they have very, very good positive outcome with this drug. So this is definitely very, very encouraging that remdesivir might be very useful in the treatment of COVID-19 patient.